Hi, so today we are going to look at balloon dilation. So balloon dilation has become really popular over past few years. It's a minimally access surgery for your sinuses and also for eustachian tube. This is a Striker express balloon dilation. Just as a disclaimer, I don't get paid by Striker, I'm not promoting it. So what happens, what are the indications? Many times what happens is the sinuses, they have minimal disease. You don't want to do a large antrostomy or large opening because there's always a risk of stenosis. Whatever surgery we do, if the opening increases, it is going to close by 50%. Especially it's more when you have got bone over there. So that's the case. Now, in this case, in balloon dilation, what happens is we go inside the nose. It can be done under general anesthesia or local anesthesia. You go into the sinus, you use a balloon to dilate it, as like esophageal dilation or any other dilation. You dilate it, keep the ostium patent, okay? The effect of it will last for maybe months or years. I mean, I have seen patients who have had balloon dilation for 2 years and they are fine. They don't have any issues with sinuses, there's no sinus collection. Obviously, it has to be planned and managed with other medical management. Maybe the sprays, steroids, or nasal douching regularly. So how does this system work? So, as I said, that this is the balloon dilation system. You'll hold over here like a pen, and this is the probe. This is the balloon, that's the probe. The probe will guide into the ostium. We have a mold, you come get a mold along with the system where you can change the angulation of the probe. Why do we need that? Because just imagine now, the maxillary sinus ostium, where is it placed? Then the frontal sinus ostium, where is it placed? Everyone has its own angulation, and the sphenoid ostium straight. So this can change, okay? It can change, and this is how the maxillary sinus ostium will be. If you go slightly more curved this way and there's a mold, you just have to fix it and you have to change it. This will be the frontal sinus ostium, and something like this, it will be for the eustachian tube. So what happens is, you numb the nose. You use whatever local anesthetic spray, lignocaine. Combine. I like to make a cocktail of lignocaine with adrenaline. Don't mix it together because it crystallizes. So use it separately. Take a ribbon gauze, dip it in 1 in 10,000 or 1 in 1,000 adrenaline. Dip it in 2% lignocaine. 2% is good. If you want to use 4%, you can use 4%. Put it in the nasal cavity. It will decongest. Once you do that, this is the attachment for the pressure system. You attach it over there, and we have got saline in this. You can see saline in this, which is used to infiltrate or inflate, not infiltrate, apologies. So how do we know we are going in the exact place? This system is one of the things I like about it is it has got a probe. Can you see this? As a light probe. So when you go in the nasal cavity, this enters the ostium. And if you go in the nose and go into the frontal ostium, this part will glow up. Similarly, if you're going to maxillary sinus, this part will glow up. We know that we are in the right sinus. So we can use that, and also those areas can be slightly in dark, so it helps to illuminate that area and seek the ostium. So once you're going, imagine we are going to do it for, say, frontal sinus. So after identifying the axilla and we want to go over there, once we have decongested, we have to introduce, and the moment we see the recess, frontal recess, we have to introduce this probe inside. And then this is the switch that advances the balloon. Can you see this? So it will advance, it will go on the ostium, and then you have to ask your assistant to inflate this. They will inflate, and as you can see, the balloon has inflated. This balloon is inflated and we keep it there for at least 2 minutes. 2 minutes is an ideal time. And once you're done, it goes off, deflates. I'll show you again. Inflation, deflation. Okay, take it gently, carefully. So once you're done the procedure, make sure that you have good hemostasis. Many times the probe rubs to the mucosa. It's normal, okay? Don't worry about it. Don't get panicked, oh, it's bleeding. If you're doing under local anesthesia, make sure the patient is aware that he or she has to spit out. If it is under general anesthesia, fantastic. You can take your own time. And if there's a lot of bleeding, you can use some hemostatic agent to control bleeding. Patient may experience pain. I would advise to give paracetamol for some time. They will stop when they feel comfortable. You should definitely follow up the patient, and the main thing is to advise on nasal douching, nasal rinsing, because now that ostium is open, they wanted to use the nasal rinse or the sinus rinse to keep it patent, okay? With steroids, and in the bottle you can add some steroids and do regular nose rinsing. There was a study which says that it is 67 to 87% effective. Well, okay, fine. If it's around 80% is quite a good number. So if it is effective, why not use it? The other thing is the only drawback is it's slightly expensive. Apart from that, it's good. So if you have selected cases which is well controlled with medical management, then why not use the balloon? Thank you.